There are really two important things that the surgeon is looking at with the CT scan of the chest when trying to decide whether the transaortic approach is the correct one to use. And the first thing that we're interested in is what the degree of calcification is in the ascending aorta, which is the segment that we have to cannulate to perform a transaortic TAVI. And in this CT scan of a patient who's previously undergone a mitral valve replacement, we can see that the ascending aorta from the level of the lower level of the innominate vein down to the aortic root is free of calcium. So there is no concern about being able to safely cannulate the aorta. The second thing that we're assessing is whether we should be using an approach through the upper part of the sternum, so a partial mid-sternotomy in the midline, or whether we should be accessing the aorta through a parasternal approach through one of the intercostal spaces. And it's the relationship of the ascending aorta to the midline and to the sternum that allows us to make this judgment. If the aorta is sitting right behind the sternum and in the midline, then the best approach is to go through an upper partial sternotomy. If, though, the aorta is lying slightly to the right-hand side of the midline, then the best approach is to go through one of the intercostal spaces. If you go through a mid-sternotomy approach, you'll find that you then don't have a straight line of access from your line of cannulation to the centre of the aortic valve. The preferred route for performing a TAVI is a transfemoral approach. It's the least invasive, it has the shortest length of stay for the patient in hospital following the procedure and the shortest recovery time. If the transfemoral approach is not feasible, then we favour a transaortic approach. And that's because many of these patients are elderly and have relatively frail left ventricular muscle. And if a transaortic approach can be safely performed, then that would be our second route of choice. And a transapical approach would be the third choice.